everybody. My name is Shelley Yates, and welcome to this very special edition of Dr. Make Me Beautiful. We're joined tonight with a patient and practice coordinator, Miss Andrea Housand.
Hello, everybody. I'm so happy that I'm not hosting my own special edition of Dr. Make Me Beautiful. I'm happy that I am the special guest. Been waiting for this moment my whole life.
Yes, you have. We're going to talk about that. We also have our favorite facial plastic surgeon, double board certified, Dr. Derek Jones. How are you, Dr.
Thank you.
Jones?
I'm doing great. This is a really exciting evening for us, and we had a lot of fun stuff to talk about. So,
very
it's really good.
exciting.
It's very exciting. So,
I like that it's come full circle, too, because I've known Shelley since high school.
That's right.
And we
Booker T.
kind of
Washington.
followed each other all around the United States, and then came back here, and then she moved away, and I took her position. She was the practice coordinator for Dr. Jones before I started.
That's
and
right.
It's been awesome.
it has been awesome. We're going to talk about that tonight.
Yeah,
too.
we are.
Yes, we are.
I think first
So-
we have some housekeeping. So you guys are
Yeah.
all over the city. Where are you going to be soon? You have some locations coming up, is that right?
We do.
Absolutely.
We do.
So save the dates that we have coming up for our off-site injectable opportunities. We're going to be, if we go to you can go to our screen, great. We're going to be in Pace at Fringe, and that's going to be the end of the month, July 25th, from 9 to about noontime. Come see us there. It's usually pretty well attended, so give us a call. You can call the salon at 994-2104, or you can always call us at 484-FACE and touch base with Andrea and get an appointment to come see us in Pace if it's convenient for you to come see us there. Fringe Salon, we've been working with Pam now for many years. Even when you were with us,
That's
Shelley,
right.
we were going out to.
It's a lovely place.
It is a lovely place, and they take great care of us, and we've had a great relationship with them. So come see us in Fringe if you're going to be out, or if you live out in Pace, or if it's convenient for you. Schedule an appointment to come see us. And then the next month, we're going to be back in Gulf Breeze proper, right in a prime location, Jacobs Chiropractic, with Dr. Rick Jacobs and his lovely wife Kim, who I went to high school with back in the day. And that's been a great place for us too. And Gulf Breeze is a great location, so convenient for all the breezers to come and join us in Gulf Breeze. So that's going to be the end of August, 8 to noon. Give us a call, 484-FACE, or you can call Jacobs Chiropractic at 916-7060 and make an appointment there. So
That's awesome. And we also are on Facebook with Derek Jones, Facial Plastic Surgery, which is it gives you all the opportunities to find out where you guys are going to be to host injectable appointments and have seminars, and you get to learn the latest of the things you have going on, different injectables
Specials.
and specials. So please check us out on Facebook.
we always put everything on Facebook. We also will do email blast with a lot of information, with specials and locations and things like that. So if you want to get on our email address or email list, just get in touch with us in the office, 484-FACE, let us know, and we'll put you on the email list. So
That's great. So tonight we're going to go way back. We're going to go back so far to Greece. Let's go back to a little Grecian girl who ended up in Pensacola. And tell us about your life when you realized that you felt like you needed to change.
Oh, let me tell you. Well, I mean, my whole life when I was young, I didn't think about my nose, but right around the time I was 14, that puberty hit, and I was like, what? So I've been probably wanting to do this since I was 14 years old. So I have my mom's nose, and she always encouraged me. She said, if you want to get your nose done, I would not object. So I was like, thanks, Mom. But finally, I think I don't know, it just, it was destiny. You got me the job at Dr. Jones, and one day he looked at me and said, I could do your nose for you. I thought, I really need to get my nose done.
But I remember when we worked in Cordova Mall. We worked at Thule Street, perhaps you remember. And it was a magic time, and we had just gotten some froyo, and we were walking through the mall, and you said to me, I really hate my nose.
I did. I hated it.
And I said, you're crazy, you're beautiful.
Well,
I still think you're beautiful.
Thank you.
Even with your new nose.
Thank you. But that's the thing, I think everyone will look at you, and I talk to patients all the time, and they say, you know, everyone's like, you're crazy, your nose is great, it's what makes you you. But it's my face, and I look at it every day, and it's something that's always bothered me. And then, of course, I broke it in my 20s, and then it bothered me even more. I'm just so happy I finally did it. It's the best thing I ever did.
It is. It's really great. And what I think is wonderful, Dr. Jones, is about your technique is you do look at the aesthetic of the face, and you really, once we see these before and after pictures, I think that everyone will notice that you look great. But you still look like yourself. So, and I think that is really what makes you so wonderful, Dr.
Well,
Jones.
thank you. I think it really brings out the best in Andrea. It brings out the best in her face. The nose in general should not be seen on the face. I mean, we should make the nose inconspicuous, and if you notice the nose is distracting from the eyes, and the eyes are the focal part of the face. And I think that's what it's done for Andrea. It's really brought her eyes out, and really enhanced her appearance just by making her nose less distracting from her eyes. And I think we'll see that in the pictures when we look at them. So.
Yeah. I think we should look at them.
Well, let's go. Before we do that,
okay.
I do want to go back and show a little visual.
Look at us.
A little visual of Shelley and Andrea from back
just the other day.
the Thule Street days at Cordova Mall and Booker T. Washington High School.
Look at us.
And
I'm like the devil perched on your shoulder, and you're like the little angel.
So
that's so true.
You really do go back a few years.
We do.
So, so that's the two of you way back when.
Look at that Greek natural fluff.
And we are going to talk about rhinoplasty, which is one of our surgical solutions. And we're going to show some pictures of this young lady right here.
Look at the nose.
And this is when she got the idea that maybe she wanted her nose done, I suppose. And
definitely. It was, I did not like my nose. And I mean, the older I got, I was accepting of it, but I'm so glad, like I said, I'm so glad I did it. Well, hey.
It's been great. So we're going to show the before and afters because people may have forgotten what you used to look like.
Okay.
And now you can see.
See, that's amazing.
So it's not, it's not a dramatic change. I mean, it just looks like it should look,
I look really angry in that first photo.
Well, you hated your nose.
So mad about your nose.
You're like, relax your face.
And then the second one, you just couldn't help yourself from smiling, I suppose.
I know.
That's it.
So
you do notice your eyes so much.
Oh yeah. Definitely brings out the eyes in the after pictures, and look at that. Fits the face so well, and that's what that's the good thing about.
After you're like, look at my nose. Look at my after pictures because I live in a different place now. And I'm like, yeah, you look the same. But now I see the pictures side by side, and I'm thinking, wow, that's a real difference. You really did something there.
Yeah, a lot of people say, well, I don't remember what it looked like before. And I said, well, let me show you my pictures.
Yeah, it really it totally balances on your face now.
So, Dr. Jones, tell the people watching exactly what you did.
Well, basically, we took the bridge down a little bit, took down the dorsum of the nose or the bridge of the nose. We rotated up the tip just a little bit of the nose and brought the tip back a little bit. The tip kind of came back a little bit, and then did some better definition of the tip with some suturing of the cartilages of the tip, and then we kind of did the osteotomies to put the side walls of the nose back together the way they should be, and that was about it. It was interesting because I always make a pretty detailed plan of rhinoplasties, but that's just kind of a plan going in, and then depending on how the nose looks during the surgery, modify the plan and things like that. And really, I remember ended up telling you afterwards, I didn't really need to do as much as I thought I might have to do or might want to do.
Thank goodness.
It just looked really good as we were going, and so it just kind of all fell into place, as they say. So
it looks really great. And you can breathe now.
I can breathe now.
And
Exactly.
That's the other thing. I mean, I think that's what is so great about your being an ENT doctor. You're really understanding what goes on inside of a nose, and when it's not just you're going in there to fix her nose, but you go in there, you fix it, and it looks fantastic. So I think people, really need to take that into consideration when they're planning to do something like this.
I do tell people, you always want to, address all of the issues with the nose at the time of surgery. You don't leave anything undone, and you want to make sure that the nose looks good and works well. So, that's always the goal going in, is to address everything, even if there's sinus problems like sinus infections or things, address it all at the same time, and that's going to give you the best result that you can. So, just really took down the bridge of the nose, defined the tip better, and you can see that the tip is not quite as broad in the after pictures.
Yeah.
And if you look down the bridge of the nose, it's not quite as wide. The bridge of the nose was kind of over projected, kind of stuck out a little bit too far, and then it was flat and a little bit broad. And then we improved that with narrowing the bridge of the nose, bringing the bridge down a little bit, narrowing it down, defining the tip a little bit better, and here we have it. It's been about 6 months ago.
It's been 6 months.
That's amazing.
I definitely had some breathing issues as well. So I'd wake up in the middle of the night and one side would be completely stopped up. And I think that happened when I broke the nose. So
Yeah, probably did. I think that was, and I think there were definitely some issues with the septum and things like that needed to be addressed in order to help you breathe better through your nose. So took care of all that at the same time. So
that's fantastic. I think we're going to take a little break, and then we're going to come back and we're going to go through what the process was like for you being a patient and also being a practice coordinator. And Dr. Jones, you'll talk to us a little bit about the healing and what to expect, and we'll be right back with a little more Dr. Make Me Beautiful.
Mark Lee's skincare products are based on over 20 years of scientific research with top quality results. Visit Mark Lee's salon in Pensacola to inquire about specialty facial treatments utilizing state-of-the-art skincare equipment and technology. Enjoy one of their many award-winning day spa programs, including the popular 4-hour half-day in heaven. Go to marklees.com for more information. Mark Lee's, science made beautiful.
Your face is the first feature people see. Confidence in how your face looks is very important. When you want natural-looking improvement, choose a facial plastic surgeon who truly listens and understands your needs. Dr. Derek Jones, board-certified facial plastic surgeon, offers both surgical and non-surgical options to make you look and feel your very best. Call a facial specialist at 484-FACE or visit our website to learn more. Jones Facial Plastic Surgery, where science meets beauty.
Mark Lee's skincare products are based on over 20 years of scientific research with top quality results. Visit Mark Lee's salon in Pensacola to inquire about specialty facial treatments utilizing state-of-the-art skincare equipment and technology. Enjoy one of their many award-winning day spa programs, including the popular 4-hour half-day in heaven. Go to marklees.com for more information. Mark Lee's, science made beautiful.
Welcome back, everybody, to Dr. Make Me Beautiful. I'm tonight's very special hostess for our very special episode of Dr. Make Me Beautiful. I'm Shelley Yates, and I am taking the place of the normal host, Andrea Housand, who is the practice coordinator for Dr. Derek Jones. And tonight, she's actually the guest star, and she is the patient. She recently, 6 months ago, had a rhinoplasty surgery, and we are talking about that, and we've seen some before and after pictures, so make sure you go on Blab and go on our website, and you can rewind it and see those. But we're talking about the process. So you decided to have your nose done, you couldn't breathe, you didn't like it the way it looked. So how does a normal person go about making this happen?
Right. Well, in my case, thankfully, I work for Dr. Jones. But you would, I would recommend seeing an ENT who also is double board certified, otolaryngology, facial plastic surgery, the best of both worlds. But it took a couple years for me to actually get the nerve to do it, because it is a little nerve-wracking to have major surgery. And finally I was like, I'm doing this. I'm tired of talking about it so much, which, I mean, you can...
I do know that this is true.
Yes, I've been talking about it for 30-something years. But when I was a baby.
Decades, really.
But overall, the process for me was... it was seamless. I think I tolerate pain well, and I just had an easy time with it. Not everybody does, but I did.
What did you do for your pre-op? You go in and...
Yes. So with the pre-op, we go over your health history. We take photographs. We go over prescriptions. Dr. Jones will give you post-op instructions. So you gotta comply with the doctor and take it easy. You don't want children or pets jumping up at you. You gotta watch out for flying balls and
in sunglasses.
In sunglasses, you can't wear sunglasses for a good month. But basically, you just come in for the pre-op and we get you ready, and the big day comes. And in my case, it was me. So I'm always on the other side with the patients, and so it was interesting for me to actually be the patient. So I got to see it from that side, which was great. The ambulatory surgery center is amazing.
So nice.
They really made me feel at ease. A few of them didn't even realize who I was until they were rolling me in. There's like, oh, Dr. Jones, he's going to take really good care of you. I'm like, yeah, I work for Dr. Jones. They're like, what? Oh my gosh. You're like, they're going to take such good care of you. It was great. I don't remember much. I went in. They made me feel at ease, and then next thing I know, I'm waking up.
And
And of course, the post-op, that first 24 hours is definitely the worst. But for me, it wasn't too bad. My brother came in from Atlanta, and he took great care of me. And it is very important to have someone with you.
That's right.
You just need to. You're a little off balance the first night, come in off of anesthesia, you're on pain medicine, you just need someone to help you.
Nose is bandaged. You got a giant bandage on your face.
Exactly. There's also some packing. And Dr. Jones, not all doctors do the packing.
Not everybody does. I put some in overnight that we take out the next day in the office, and I think it helps reduce risk of bleeding. I think it I find it heals a little bit better if we do it that way.
Yeah.
So.
And I really was a little concerned about that. I thought I was going to be really anxious, but I was fine. I just, you breathe through your mouth for 24 hours. I got some Biotine moisture spray, because I was constantly spraying my mouth, and of course drinking water, and just every 4 hours I took my antibiotic and my pain, some pain medicine, just to be ahead of the pain, and it was pretty easy for me, but not for everybody.
Right. And one thing I would say about the packing is I think that even if people don't use packing, the nose gets very stuffy that first night, and I think the advantage of having the packing in the nose is that when we take it out the next day, it's kind of kept the swelling in check overnight, and people can actually breathe better through their nose after taking out the packing the next day than if we didn't put packing in. It would swell up more on the inside overnight and get stuffy, and then be stuffy. The stuffiness would be worse during the week, the next week. So I think it's an advantage to do that, and but patients typically do fine with it. I mean, after we take it out the next day, they feel pretty good, and then gradually just get better and better the first week, and make a lot of progress in the first week, so much so that at a week after, when you take off the tape and the cast off the nose, clean out the nose a little bit, most people feel pretty good. I mean, they don't, and they have maybe a little bruising that's going away, but overall don't feel too bad. I tell people not to do anything real strenuous for about 2 weeks, like working out, because we don't want to stir up any bleeding, that kind of thing. And then not wear glasses or have any risk of any, taking a blow to the nose, no contact sports, dodgeball,
dodgeball.
No, nothing like that for about a month
How
after.
much do you, a lot of times when people plan to have an operation on their face particularly, there's downtime. So how much time would you recommend someone, miss work or what? I mean, it would seem like you have a little bit of a cast, but you could probably do some jobs.
Yeah, exactly. I mean, I would say a week would be, most people would be fine in about a week. I mean, you may still have a little bit of bruising, can cover with makeup, or it's getting better after about a week or so. But even short of that, I've had people work from home or do things like that even inside a week while they still have the tape and the cast on the nose. Nose is kind of stuffy that first week, but you're right, you don't have to be completely immobilized during the whole first week, and then after the first week, most people feel pretty good.
Can go about their business.
Go back to work.
I had some bruising, but I went out on New Year's Eve. I think like 9 days after the surgery.
Right.
But I had some great makeup.
Yeah. What's the cover-up that you use when you have injectables on your face and any kind of bruising?
Well,
it's great.
I do like the Color Science corrective palette, which I got at Welch Skincare. I don't believe they carry it anymore, but you can get it on Amazon Prime. But there's other camouflage tricks, like mixing lipstick with concealer to cancel out the blue and the bruising. But yeah, it's definitely tricky to cover up bruises. But I did all right.
A good job. And anytime anybody comes into Dr. Jones to have Botox or have your lips injected or have a nose job, you definitely give them those tips and show them how to camouflage that stuff. So
Right. To help really camouflage. That's a big advantage. I think it's also been really good for patients to be able to talk to somebody who's had the surgery, who's been through it, knows what to expect, and I think it's just really been good for patients, and it's really been good for our practice. And the other thing for me personally is to see someone almost on a daily basis that's had the surgery, because usually I see patients the first day after, a week after, a few weeks later, 3 months, 6 months. I don't get to see the day-to-day fluctuations that patients see, and I know that there's changes that patients looking at it all the time. I can get a better idea of what they're seeing on a daily basis, which is different than what we see.
Yeah.
So.
Yeah, and there was swelling when the cast first came off. I still loved it. I was amazed, and but I did have some swelling for a couple months.
Several months. It'll probably
fluctuated.
Even now at 6 months, it may change a little bit over the next 6 months, but most of the changes have occurred, and so
6 months.
6 months is a good. It's not going to change dramatically really over the next 6 months or so, but most people consider 1 year to be final results, and we'll probably come back and show some more pictures a year from now, so that'll be even more fun. But at 6 months, really, like you're saying, you can get, right after the cast comes off, you can get a little bit of rebound swelling, taking the tape off and everything. And on occasion, if people are very concerned about it, I'll even put a little more tape on the nose again for a little brief period of time to help them get through that. But really, it's going to be fine. And so, but then after that, swelling just gradually gets better and better over time. So. And
I do tell patients that you're going to give them the nose that works with their face.
Right.
I know we do have a lot of patients, they bring in photos or like, I want this nose. And it may not fit your face. So.
Yeah. Part of it is fitting your face, and part of it is making the nose that you have the best nose that can possibly be. Yes, giving you the best nose, making your own nose the best it can be. And usually the issue with it is that there are things that make the nose look, out of place and make it obvious. And if you can take away those things, like the bridge of the nose in Andrea's case, was too broad and was stuck out too much, and those sorts of. If you can make take those things away, you make that nose look better. It's not changing it into, a movie star nose. It's just making their nose look better and bringing out the eyes and that kind of thing. So, So I think that's what we did in her case, and that's always our goal when we do the nose
Yeah,
surgery.
a lot of people, friends that hadn't seen me in a while, they'll look at me and they can't pinpoint what it is, but they know I work for you. So
Right,
like,
true.
I need to come and see your doctor. I need some Botox, or I need some Dysport, or I need some filler. And I'm like, well, I had all that, but that's not what it is.
That's not what it is.
This is true.
It's my nose.
Right.
But yeah, it's been.
That's the point, though, right? I
Right.
mean, just to make it
Yeah.
not look like you've
Yes.
had something done. It's
Right,
just
right.
the natural.
Make it look natural and make it
Beautiful.
and make it look
Andrea.
the way it's supposed to look.
Meow.
Is the
Meow, meow.
whole thing. So.
So
So we can show the pictures as we go out
Yeah,
too.
let's
If one
show 'em
people
out. Let's show 'em
take a look
again.
at some pictures. Yeah, absolutely. Let's go to the pictures one more time and look at that.
Oh
nose.
man,
So
look at that schnoz.
That's
yeah.
not a schnoz. You're a beautiful
yeah.
girl.
And you've like you said, we've done a few other things as well.
Yeah, we actually did some lip, and we did the Restylane Silk on my lips. So you can see they're a little fuller, but not unnatural. Not unnatural.
But
At least I
looking
don't
good.
think so.
No,
And then we did some Sculptra, which is the collagen synthesizer
Synthesizing
stimulator.
agent. Absolutely.
And it did give me a little bit more volume in the cheeks. Not so much like my cheeks when I was 19 in that photograph, but
Right. You've got the beautiful Obagi skincare.
You know that's
that
the
you
truth.
are-
That's true too, because you've been
Thank
a
you.
faithful,
That.
faithful
Obagi.
Obagi user for
Amen.
a long, long time.
that and
so-
staying out of the sun.
Yeah, that
yes,
sun is
amen.
tough on the face. Sun
It is.
Yeah.
Yeah,
Wow.
ages.
Well, this has just been
It's been
the highlight of my life.
Well, it's been great to
say.
have you back home,
Thank
Shelley. It
you.
really has. Thank you
Thanks.
for coming and hosting the show. We
Oh,
really appreciate
thank
it.
you very much.
Yeah.
And on behalf of everyone at Derek Jones Facial Plastic Surgery, thank you for watching Dr. Make Me Beautiful, and we hope to see you again next time.
Good night. Thank
Good
you.
night.